when you are subjecting to any treatments, let's understand what are all the positives and what are all the negatives. The only risk which is very life-threatening and which is very serious is, but here we are consciously giving less hormone dose to grow only limited eggs. Say for example in elderly couples, when a woman is undergoing stimulation for IUI, unusually, unfortunately, whatever the dose we give, the follicles will not grow. So now we are into the 9th part of no IUI, no IVF ICSI. No IUI end to end ends with success. So what is this 9th part is like one of the most favorable part for most of the people, IUI cancellation and IUI risk. Because when you are subjecting to any treatments, let's understand what are all the positives and what are all the negatives. Because sometimes if you are undergoing this treatment without your knowledge, it's a big problem. Nobody should do that. Everybody should have that clarity, awareness and understanding. When I undergo a treatment, let me understand what are all the remote complications, what are all the very unknown limited complications, very rare complications. So these things should be kept in the back of your mind before taking any decision. And you should not, nothing should be hidden from you. You are the people who are subjecting your health to undergo a treatment. So there you should have no hidden factors. Everything should be transparent and everything should be well explained before subjecting yourself for the treatment. Okay. So let's now go for that. What are the risks in IUI? So earlier in IVF also I have mentioned this small risk. The only risk which is very life-threatening and which is very serious is OHSS, ovarian hyperstimulation syndrome. So which I mentioned earlier. Now the same complication is here, but very less chance. Because in IVF it's like a sharp-edged weapon. We have no choice other than to give high dose of hormone injection to grow all the eggs inside. But here we are consciously giving less hormone dose to grow only limited eggs. So here the chance of ovarian hyperstimulation is very less, but however it is not completely not avoidable. Very few sensitive female partner, when we give some less dose of hormones or medications and they are having anovulation or resistance to egg growth, in the subsequent month in the IUI, when we increase the dose, double the dose or triple the dose just to ensure that the follicles should catch the growth, what happens is suddenly this follicles will grow in abundance, in maximum numbers. All the follicles will get pushed. They are called all or none phenomenon. So many very rare, unusual complications triggering this OHSS will take place. So even in those situations, as we all mentioned, the medical advancement in subfertility treatments and the research and the treatment modalities have ensured that the morbidity and the mortality, that is the life risk, has significantly been taken care in this OHSS. So need not be worried, but let's be cautious. Sometimes the doctors gives the safety of the patient, safety of the female partner more than the outcome, success. Some female doctors are very conservative because when they exceeded a particular threshold of duration, when they exceeded the schedule of dosage, they don't want to increase the dose further for the sake of getting this hyperstimulation. So these are all very customized. The individual clinician has their own ideas and their own experience, preventing them to go for that such, taking risk in stimulating the ovaries, maybe ending with such complications. Okay, so this is about the IUI risk. Now we will go for that IUI cancellation. However, I am very optimistic and I am very positive. I have told everybody should go for IUI in the initial level before stepping for IVF, just to ensure that the couples are prepared even in a better method compared to natural and compared to IUI, uncompromised coupled preparation. They are borrowing some time to get the problems reduced, medical problems and the psychological problems to be significantly reduced. Lifestyle is improved before stepping for IVF to get a healthy baby, not only a mere biochemical pregnancy. So in that duration, say for example in elderly couples, when a woman is undergoing stimulation for IUI, unusually, unfortunately, whatever the dose we give, the follicles will not grow. So when the follicles are not growing, we cannot do an IUI. So we are now understood that very rarely some women have resistance to growth, follicle growth, and very terminal stage where the follicles are not getting pushed to grow and complete the treatment. So in those cases, the IUI will be cancelled. So this is a very small subset of people who are in very extreme age, who are having very low reserve, may end up in cancellation. Otherwise, this is not a very common challenge. So IUI risk and the complications and failure IUI cancellation rates is very clearly explained, and this is for completion. So let's meet in the 10th topic.